The topic that we are going to be talking about is taking care during COVID-19. My name is Aditi, and I am the Community Engagement and Project Officer from the Center for Culture, Ethnicity and Health. Before we start this session, we would like to acknowledge the traditional owners of the land where we are meeting today, the Bonwurrun and the Wurundjeri people of the Kulin Nation, and pay our respects to the elders past, present, and emerging. I would like to introduce who we are. The Center for Culture, Ethnicity and Health help government and community services to provide health and community support services for people from refugee and migrant backgrounds and international students. The Multicultural Health and Support Services, which is a part of the Center for Culture, Ethnicity and Health, work to promote good sexual health and prevention against infections such as HIV and viral hepatitis. We also provide alcohol and other drug support for refugee and migrant background, asylum seekers, and international students. I will hand it over to Kanwal to introduce herself now.
Hi everyone. Thank you so much, Aditi. So my name is Kanwal Salim and I work as a Community Engagement and Projects Officer at CEH as well. So before moving forward, a bit of housekeeping, although Shane has done most of the part, but I just want to repeat it. So this session will be recorded and Shane and your teachers will be sharing post-session notes with you. The whole presentation will run for around 40 minutes and then we will have 10 minutes for question and answers. You're free to keep your video on or off as you like, but we would request you to kindly keep your mics off throughout. And if you have any question at any time during the presentation, please feel free to ask it in the chat box and we'll be answering all the questions together in the last 10 minutes. All right, before starting, let's decide some ground rules. So ground rules are some rules which we expect all of us to follow throughout the presentation. So the first one is respect and be polite to each other. We would request all of us to kindly respect and be polite, and even if you don't agree with something which is being shared in the presentation, please express that politely in the chat box. The second is don't feel shy or embarrassed in asking a question. So if you have question, like no matter what kind of big or small the question is, please feel free to ask it in the chat box and don't feel shy. If you feel uncomfortable at any time due to anything, due to the content being shared or due to any comment, kindly speak to Shane, Pip or us separately in the chat box, or you can email us separately after the session as well. And the last one is participate actively during activity. So we have planned an activity for you at the end of the session. So I would request you all to kindly participate actively. All right.
Okay, so what is mental health? Mental health is an expression we use every day. So it is very important for us to understand what it is. Mental health is a state of well-being for every individual person who can handle the normal stresses of life, can work well, and is able to get back to his or her own community. So rather than being about what's the problem, it's really about what's going well. Therefore, mental health is about wellness rather than illness. Next, I'm going to just talk a little bit about mental health during the COVID-19 pandemic. Coronavirus outbreak and practicing self-isolation have been stressful and affected us all. Constant news and information about the COVID-19 may have upset many people, and it is natural to feel a range of emotions. Some emotions can be like stress, worry, low mood, or even anxiety.
So Aditi has already shared with us that how it's perfectly normal for everyone to feel a range of emotions. So what can we do to cope with this, and what can we do to keep good mental health? So during this difficult time, there are a few things, there are a few ways we can help ourselves and our community, and I'll go through each of them in detail later, but let's go through them. So number one is keep a healthy lifestyle, stay informed, think positive, and access, which means get support. So let's start with the first one. How can we keep a healthy lifestyle? So there are a few ways which can help us to have a healthy lifestyle. So the first one is to set up a daily routine. Why? What's the benefit of having a daily routine? Because research has shown that having a daily routine and doing your work organized in an organized manner actually helps in reducing the stress. Stay active. You don't actually have to go to a gym or a studio to exercise. You can easily do small exercises at home by watching online videos on YouTube, or maybe going for a long walk in the neighborhood, or even if you have a garden, you can have a walk around that garden. And or maybe if you have little children with bikes, you can actually take them with you on their bikes and on your long walks. So it will help your whole family. Eat well. Eating well means to have a variety of nutritious food in your diet. So it's not just eating unhealthy or just one kind of food, but having a mixture, having a colorful plate. For example, eating fruits, vegetables, meat, pulses, milk. So like having all kinds of food on your plate. Stay connected with friends and family. We can understand that we cannot visit our friends and family as often as we used to visit them before COVID happened. But we can still stay connected with them via technology, via our phones, on WhatsApp, on Facebook Messenger, on Skype, or any other way you use to have a chat or maybe have a video chat with them. It's all about staying connected and feel like a community. The last one is practice safe sexual activity. It's very important for you to protect yourself as well as your partner. And for that, you can use protection in the form of condoms or avoid unwanted pregnancy by using contraception of your choice. If you are not sure about the contraception choice, you can always talk to your doctor and discuss it with them. The second one is stay informed. What does staying informed mean? Staying informed means getting information from trusted sources, getting correct information, getting accurate information. So you can use a variety of websites for that. Number one is if you want information on COVID, you can always go back to government's website, which has the most correct and most authentic information available. Shane and the team will be sharing the website links with you after the session. Another website which is a project of CEH is Health Translations. So it has over 21,000 free resources in over 160 plus languages. So it's a very easy to navigate, very easy to access website where you can find information in 160 above plus languages, and they are totally free. So if you see on the left side of your screen, I have actually copied how the website looks like. So if you go on this link, which is here, www.healthtranslations.wic.gov.au, it will take you to this page where there's two bars on the first page asking you the keyword. For example, if you want information on mental health, you write mental health in that bar, this one, and then you select the language. For example, my first language is Urdu. So I write Urdu there and I press go. So it will take me to the page which has a lot of resources and like all the resources which are available on mental health in the Urdu language. If you want mental health in Chinese, you can put Chinese in the language, and then it will take you to the resources which are available on mental health in Chinese language. And it's same for all other languages. So it's a very simple website to navigate and to use, and just give it a try. And it's not just on mental health, you will get information on a variety of topics. The third one is think positive. What does think positive mean? So we all know that the past few months have been really unpleasant with the pandemic on us, but remember that it will all pass, it will all end. So remember, just focus on what you say to yourself. Listen to the things you say to yourself, rather than focusing on negatives like, oh, this is a really bad time, I don't know when it will end, I'm just stuck at home, I can't go and meet my family, that these are sad times. So rather than thinking all these things, try to focus on the positives. For example, we can do it. We are moving forward. Things will get better. We are getting more time with family during isolation. So rather than focusing on negatives, try to focus on the positives of the situation. So now let's talk about how it is when we return to normal. As you already know that restrictions around our state and around Australia are easing. But how is it to go back to our life before COVID? So returning back to normal is not easy, and it's hard for all of us, for me, for you, for our communities. It's very difficult. But for example, when we go out now, we feel nervous. We are scared to go back to work and school. We are scared when we think of meeting our elderly relatives, or when we go out for outdoor activities such as parks or restaurants to eat. All these things were very normal before COVID happened. But now, when we are returning back to our pre-COVID life, all these things are actually making us nervous and scared. So how can we make this process of returning to normal easier for us, for not ourselves only, but for our whole community? So let's discuss some ways we can do. So go back into routine. Why? As we have already discussed, that building a habit, having a daily routine actually helps to reduce stress, to decrease stress. So set up a routine, write things which you want to do in a day. Start your day with one thing which you do daily, like maybe a walk, maybe make yourself a cup of tea, and just go back into the routine. And like slowly start going back to your pre-COVID routine. Focus on what you can control. It's very hard when you think of unknowns, when you think about the things which you cannot control. So rather than focusing on things which you cannot control, focus on what you can control. For example, planning, setting up a routine. Plan your weekend, for example. Just take it slow, take it one day at a time. Maybe plan the coming weekend. Maybe plan cooking some delicious dish which you haven't done in a while. So focus on what you can control. Revisit social distancing rules and hand washing. Revisit means revising, to repeat them. So remember social distancing rules wherever you go. Keep 2 meters distance between you and the other person, no matter who you are meeting. And just remember to do hand washing. When you go out, when you come back home, just wash your hands. Wash your hands before you have food somewhere. You wash your hands when you go to someone's place. Just keep on, because it's healthy. It's not just in COVID times, but just include it into your daily habits. So remember social distancing rules when you go out, whether it is at someone's place or in the parks or in the restaurants, and remember washing your hands. The last one is explore the positives. So personally, I'm scared to go back to work as well. I'm working from home and I'm scared to go back to work. But I know it's scary and it's concerning for everyone. But think of the things which you loved about your school, or the things which you loved about your work, and the things which keep you moving forward. If you're not sure about those things, I would suggest having a chat with or talking to your teachers. Discuss how you feel with your teachers. Discuss how you feel with your friends. Discuss how you feel with your family. If you share your concerns rather than just keep on thinking on them, share it with others and focus on the positives. Remember the things which used to make you happy at work or at school. Focus on those things. Remember those good times. And the last thing is access support. So the word access means to get support, to seek support. So remember that support is available. If you are feeling upset, or if you're feeling stressed, or if you think that you cannot take it anymore, just don't hold. Please reach out and use the support which is available. So I have written a few websites and a few organizations which provide support around mental health. Uh, in this slide, there are phone numbers available and their websites, but in the post-session notes, I have provided the links to those websites. So when you click on those links, it will take you to that website, and you can see what you want to and how you want to get the support. So number one is Beyond Blue. It's a very famous organization, and it only focuses on mental health. The number is available. You can contact them anytime you want, and they have resources on their website. They also have chat available, and you can always talk to them anonymously. You don't have to tell them about yourself. You don't have to tell them your name. You don't have to tell them anything about you, but just your problem, and they will talk to you about it. The other one is Headspace. It's usually for young people, but older people can access it as well. Then we have Black Dog Institute. Black Dog Institute is an organization which is situated in New South Wales, but feel free to visit their website and read through the resources which are available. A few of them are MindSpot, Every Mind, Smiling Mind, and ReachOut.com. So Smiling Mind has an app which is free. Whether you have an iPhone or an Android phone, you can actually install it from the Play Store, the app, and it's free for everyone. They have small 5 minutes, 3 minutes, 10 minutes meditation sessions. So you can always use this website maybe before going to bed or during any time of your day when you're not feeling quite well, or if you're feeling upset, or if you want some time off. You can always take a break, and then you can use this app. It's free for all, so feel free to use it. All right, so I have done a lot of talking now, so let's take 1 minute break. You can go get yourself a cup of tea, or maybe just do a bit of stretching, and then we'll get back after that 1 minute. Thank you. All right. Welcome back. Yeah. So we have an activity now, which Aditi will be doing with you. Aditi, over to you.
Thanks, Kanwal. So now we are going to do an activity all together. The activity that we are looking at doing is how to practice switching on and off. Our minds work as a switch, and switching our minds off sometimes is a very important skill that helps us to keep safe and stay alive. Now, I would like everyone who is in the session today just to make a to-do list for tomorrow. What you need to do is write 3 tasks which you are planning to do tomorrow, and then you can do it in your workbooks or you can put it on your chat. And after you have completed that, it would be a great opportunity to share it with your classmates or your teachers. Just to give you an example, Kanwal, do you want to share your to-do list for tomorrow?
Sure. So I have 3 tasks which I have written. Number one is exercise. So I'm trying to get in the habit of doing exercise daily for 45 minutes. So that is on my to-do list. The second thing is I have been working on this project which I have to complete tomorrow. So that's on my list. And the third thing is try a new salad. So I have to try making a new salad. Yeah.
Thank you, Kanwal. So I've seen that Pip has already sent through her to-do tasks for tomorrow. Does anyone else want to share their to-do task for tomorrow?
So we have one from Barbara. Barbara said she will be finishing her report. She'll be calling her sister and she'll go for a long walk. And we have Parisa writing now. And Pip has shared home workout, friend over dinner, and read her book. So Parisa has came up with 2. So go to Preston campus, meeting students and collecting books. And I think she's thinking about the third one now. And catching up with 2 colleagues. Yeah, done. And doing yoga as well. Parisa has 4. That's good. And now Aditi is typing as well. So Aditi, you
Yeah, okay. So
you have to set it to everyone that.
yeah, I know. Sorry about that.
So
Yeah.
Aditi has written, buy a book for my daughter that I had promised and going for a walk. What's the third thing, Aditi?
I am planning to cook something for tomorrow as well.
Okay, good. All right. If just feel free if someone else wants to share their to-do list with us. Since we are a small group, you can actually unmute yourself and just say it. Okay, so Chui has her to-do list as well. So for her, it's morning yoga, run to a hotspot restaurant in the city and walk back, and edit a student's writing. Yay! All right. Yeah. So question and answers, if we have any. Do we have any questions? If you haven't asked before, it's the time. Just feel free to ask any questions.
I would actually encourage some of the teachers that are with us to think back and reflect on some of the classes from earlier in the term where health has been discussed as on Zoom and through perhaps some of the materials that have been posted back. Are there any recurring themes or any health concerns that students have expressed in class that you could share with us?
Sorry, it's Parisa. We have asked our students to return their books, their assessment books, to school if they feel comfortable next week. And I think initially when we went into lockdown, everybody was like, we want to come back, we want to come back to class. They were very keen on meeting up. But as time has gone, I think, as you mentioned, everybody is a little bit nervous around, you know, meeting others, and they feel a bit uncomfortable around probably maybe a group, you know, larger than 5 or 6 people. Yeah, so it would be interesting to see how they would go next week. We have divided the group into 2 sort of smaller groups, but still I think some students, I can sense that they are not very comfortable. They want to come, but at the same time, yeah, they're not very sure. Yeah, it's just going back to something which we would not even think about it before, is now something that I think all of us are a bit hesitant to do.
Yeah, I think this is something which I shared earlier as well, that all of us are a bit nervous, all of us are a bit comfortable when we think about going back and meeting people face to face, especially work in school when we have more people around. I think it would be good if you talk to them, if it's possible, maybe on call or maybe on like this kind of Zoom session, and share with them that we all are nervous, we all are uncomfortable, and you know that it's hard, but you can actually share with them the facilities, like you have already prepared how they are going to sit with physical distancing in place, and then maybe they can bring their mask and gloves with them, or maybe if you guys are like happy to provide them with, so maybe sharing these kind of and reassuring them that we have precautions in place, and we all are scared and we all are uncomfortable, we all are nervous, it's not just them, and it's perfectly normal, because this pandemic actually this has shown us that we were not ready. We have never thought about something like this to happen, and it happened, and it's natural for humans to feel this way, to feel a bit hesitant. So the best way to be is to have a chat over Zoom, or maybe Zoom would be a better option, because then on Zoom you can actually see each other and you can see each other's expression. So yeah, just have a Zoom meeting with smaller group and reassure them that it's fine, it's okay to feel this way, but obviously we have to move forward, and you have these precautions in place, and you will be practicing social distancing, hand washing, and other PPE related measures as said by government. So yeah, I think that's the best way we can all go about.
Thank you. Yes, we will try that. Yeah.
Thank you. Any other question?
There is a question in the question box. I'm not sure if you can see that, Kanwal.
Yeah. So if a student around 60 and 65 old has health concern for returning to school next term, what would you talk to them? Interesting question. Obviously, if someone has health concern, like what kind of health concern are we talking about here? If they already have an underlying condition, we can't ask them to, we can't force them. because obviously they are the most vulnerable group, and it would be good for them to maybe attend classes online. When is the next term starting, by the way? Next month?
Yes, it will start on, well, some classes will commence from Monday, the 13th of July.
Okay. So July is still early, and since we don't have any treatment or vaccine available at this time, what we can do is just preventive measures. And I'm really not sure how we can go around people in that age group, because they are the most susceptible and more vulnerable one. So you can talk to them, you can reassure them, but if they have any underlying condition, it would be best for them to maybe attend classes online, or maybe. Yep. Yeah.
I think a big part of COVID and sort of managing is understanding individuals' needs and circumstances. Yeah. So depending on your age or depending on your medical history, yeah. And then also your ability. Some people are a bit hesitant to use public transport, which is understandable. Yeah. And as you say, it is. It's all normal. It's all natural that the changes keep happening every day. But I think that probably two things is for students to feel comfortable to talk to their teachers to discuss what alternative arrangements might be. In some cases, some students may return and some students may continue to work remotely. And that is part of our new normal. And I also think there is also a special consideration we all need to make on our own personal health. At any given time, if we have a sniffle, if we have a cough, we just need to be mindful that where we are going to interact with others, that there is a risk factor that may be higher because someone is unwell, whether it's ourselves or others. But firstly, we can take care of ourselves. So, and really the teachers before students and staff return to campus will be letting, certainly going through some training themselves, but also the students will need to be aware of what measures are in place so that they feel safe in returning and they behave safe when they do return. So, but certainly talk to your teacher, and if you have any personal health concerns, I expect you'd want to perhaps talk to your doctor as well.
Yeah. Is Yuli a teacher or a student?
I think they are a student.
Okay.
Perhaps.
Yeah. Do we have any other students today with us?
I'm not sure. I haven't met Lenovo before, so I'm not sure if they are a student or a teacher. I'm sorry. There's lots of staff and many, many more students. So
yeah, I think it would be a good idea to actually share this presentation with them. Although since it's the first presentation, it's very small. It's a very short one, very easy to understand. And if they have any questions or if they have any suggestions for future sessions, we'll actually plan something on the particular topic which interests them. And we'll maybe plan something detailed if they want, with more activities, with more information. This was just a trial, and that's why we just included very, very briefly. And we did not want to focus on COVID, like the symptoms and the stuff, because it's everywhere. You see it all the time on TV and read it everywhere. So we thought it would be a good idea to actually focus on what we can do and what's next. So yeah.
Yes.